Hello everyone, I am Dr. Jo Jingi. The medical world is currently undergoing a major evolution aimed at reducing the daily burden on patients and enabling them to live life more on their own terms. Let me ask you a question. What comes to mind when you hear the term insulin injection in the context of diabetes treatment? Having to inject myself before every meal or at a set time every day. That is likely the image many of you have. Indeed, the standard medical practice has long been that insulin is something to be injected daily. However, new research findings have recently been announced that could completely overturn this norm, attracting significant attention from medical professionals and patients around the world. In this video, I'll explain, in simple terms, the basics of diabetes, how it is currently treated, the latest research into once-weekly injections, and the future direction of medical care. Let's start by clarifying the relationship between diabetes and insulin. When we eat foods like rice or bread, our bodies break them down into glucose, which serves as energy. The hormone insulin, produced by the pancreas, is responsible for delivering this glucose into the rooms or cells throughout our bodies. You can think of insulin as a delivery person holding the key to open the cell doors. When this delivery person does their job well, glucose in the bloodstream is smoothly transported into the cells, allowing us to stay active and healthy. Diabetes is a condition where the number of these delivery persons decreases, or the keys malfunction and the doors won't open. This causes glucose to build up in the bloodstream, damaging the blood vessels. There are two main types of diabetes. One is type 1 diabetes, where the delivery persons are absent due to congenital factors or immune system abnormalities. The other is type 2 diabetes, where the delivery person's efficiency drops due to a combination of genetic predisposition and lifestyle factors. It is said that over 90% of diabetes patients in Japan have type 2 diabetes. So, how is type 2 diabetes treated? Treatment typically begins with dietary therapy, exercise therapy, and oral medications. Oral medications play a role in supporting the delivery workers remaining in your body or improving the lubrication of the keyholes. However, as the disease progresses or the body's ability to produce its own insulin declines, insulin therapy, directly supplementing insulin from an external source, becomes necessary. In particular, the insulin used to replenish the baseline insulin that the body requires 24 hours a day to sustain life is known as basal insulin. Until now, the standard practice was to inject this basal insulin once a day. You can think of it like watering flowers at a set time every day. By remembering to water them daily, you kept the flowers, representing your body, hydrated. However, for patients, this routine imposes a significant psychological and physical burden. I have to carry a syringe with me even when I travel. What if I forget to take my shot while I'm at work? I'm scared to stick a needle into myself every day. For reasons like these, many patients hesitated to start treatment, even when their condition actually called for insulin injections. Recent research data published in the prestigious New England Journal of Medicine has demonstrated the potential to shatter the conventional norm of daily injections. In this trial, 795 adults with type 2 diabetes who had never used insulin before were divided into two groups. One group received conventional insulin, glargine, injected once daily. The other group received a new insulin currently in development, Efsitora, injected only once a week. Instead of watering the plants every day, imagine switching to a special type of soil that releases moisture slowly and steadily over the course of a full week after just one watering. A 52-week follow-up study yielded some remarkable data. 1. Blood sugar lowering effects are virtually equivalent regarding the reduction in HbA1c, a measure of average blood sugar levels over the past few months. The decrease was 1.16% for daily injections and 1.19% for once-weekly injections. This confirmed that the once-weekly injection provides robust efficacy comparable to daily injections, demonstrating non-inferiority. 2. Lower risk of hypoglycemia. Hypoglycemia, where blood sugar levels drop too low, is the side effect of greatest concern in insulin therapy. The study found that the annual incidence of hypoglycemia per patient was lower with the once-weekly injection, 0.50 episodes, than with the daily injection, 0.88 episodes. 3. Drastic reduction in dosage adjustments. Insulin dosages are fine-tuned based on the patient's condition. The median number of adjustments required was 8 for the daily injection regimen, whereas the once-weekly regimen required only 2. This indicates the potential for a treatment that is far easier to manage for both patients and healthcare professionals. This indicates the potential for a treatment that is far easier to manage for both patients and healthcare professionals. There is one important point to consider objectively here. These results do not mean that the once-weekly injection is dramatically superior to the daily injection. In medical terms, this is known as non-inferiority. Essentially, it has been proven that the new method is just as effective as daily injections. In other words, it is not inferior. Furthermore, this does not mean that the world will switch to once-weekly injections all at once starting tomorrow. For a new medication to come into widespread clinical use, several steps must be taken, such as obtaining government approval and establishing protocols for actual implementation. Even so, the shift from the long-standing norm of having to inject every day to the option of potentially injecting just once a week is wonderful news that significantly lowers the hurdles to treatment. Medical technology is advancing ceaselessly, day by day. We are transitioning from an era where accepting lifestyle restrictions and inconveniences was simply the price paid to preserve one's life, to an era where patients can undergo treatment without giving up their daily routines or the things they want to do. As the forms and methods of medication evolve, such as the once-weekly insulin we discussed today, patients will spend less time preoccupied with their illness, enabling them to lead freer lives that are true to themselves. A bright future is certainly dawning in the field of diabetes care. If you or a family member are concerned about diabetes treatment, I encourage you to have a positive conversation with your doctor about your future treatment options. I encourage you to have a positive conversation with your doctor about your future treatment options. That concludes this video. Thank you very much for watching. That concludes this video. Thank you very much for watching. If you found this video helpful, please subscribe to the channel and give it a like. See you in the next video.